I'm Simone Ungaro. I'm the CEO of Movendo Technology, a company I founded 5 years ago together with the leading Italian biopharma entrepreneur Sergio Dompe. After 7 years of incubation at the Italian Institute of Technology, and that's where everything exactly started some years ago. I was engaged in my previous experience as Director General of IIT, and as I was building the Institute, I was really impressed by the effort that robotic scientists were dedicating in understanding the anatomy and the functioning of human beings in order to replicate it on robots. And iCub is one of the examples that you see in the video, the most advanced humanoid robot worldwide. At that point, I had the vision that and the inspiration that we could use the very same technology on robots that was inspired by humans to take it back on humans in the world of rehabilitation. And that's how we conceived Unova. That is our product that we commercialized. Unova is the most advanced rehabilitation robotic platform worldwide. And in a nutshell, it can complete two different tasks that are integrated with each other. On one side, Unova can assess, as you can see from the video, all our biomechanics, understand how our nervous system is working, our muscles, by mobilizing the different part of our body, from the ankle to the knee to the pelvis to the entire body. And based on this information, it can therefore assess what pathologies and what impairments we have, and we've developed several protocols that tackle different pathologies. So we have one tool that provides objectivity in the measurement, but also a personalization in the treatment, and this has been a revolution in the world of rehabilitation. More in detail, in the clinical areas that we cover, there's a wide spectrum of applications. We go from the most severe neurological disorders coming from spinal cord injury or traumatic brain injury into the neurodegenerations such as Parkinson or multiple sclerosis, where we work with top scientists and top medical societies worldwide. We are also engaged in orthopedics, from the most common back pain to what is more complicated within pre and post rehabilitation for prosthetic surgery, where we have partnered with Smith & Nephew, a company that's a leader in this sector worldwide. And we're also engaged in sports, where we help professionals and non-professional in various sports, but also Paralympics, in order to improve their physical performance or regain mobility after injury. So in a nutshell, our technology is a complete suite that combines robotics, but also digital solutions that derive from artificial intelligence and machine learning, that all together provide different solutions according to the age factors and the different conditions of our patients. So we go from the sports people in the performance index, in the world of ortho and prosthetics with the knee index, and where we're also engaged from the very beginning of the pandemic in understanding why people that got COVID had lingering symptoms, physical impairment, and together with the Sacco Hospital in Milan, we were the first one to assess the post-COVID syndrome, or long COVID as it is called, and we now have protocols to assess and treat the long COVID that has been published in international journals, and that we're implementing worldwide. But what has made the real change, an additional change in the use of our technologies, was not only in managing the data in order to provide personalized treatment and objectivity, but also use the data and artificial intelligence to predict traumas and injuries. And that was the very first solutions that we launched couple of years ago. That is the Silver Index, that opened the door to a very strong collaboration and partnership with the Generali Group. Together with the Generali Group, we're now testing the Silver Index. That is, in a nutshell, it's an algorithm that is able to predict in a matter of minutes the very first cause of injury and disability, and often death, unfortunately, of people over 65, that is fall. We have studied with our technology for several years people suffered falls in their life, trying to understand what were the predictors at each time they fell. And we therefore derived 135 parameters that compose the Silver Index that the technology can detect in a matter of 15 minutes. As you can see from the video, it is it's a gaming session. So we turned something that was really boring, like rehabilitation, nobody likes it, into entertainment. So patients play around with the technology that perturbates them, and in those 10-15 minutes, it's able to collect those 130 parameters that then lead to the overall silver index, which is a figure of percentage of fall that person is exposed to, the reasons behind it. So you get a diagnosis of why, what are your weaknesses, and therefore you get also a suggestion of a personalized rehabilitation strategy to work on those weaknesses and reduce the risk with the technology itself. So you got a turnkey solution with a prediction and a prevention strategy. We are testing these solutions together with Generali in Germany in a vast amount of populations of people scattered around Germany that have been testing for the past 4 years our algorithm. They're actually living throughout their lives in the prediction and prevention strategy of the silver index. The results are extremely promising. We will end the study at the end of 2022. And we're getting very positive feedback from elderly people because now they see a clear pathway. They like Unova because there's a clear pathway what they have to do for their prevention. Together with Generali, Movendo managed to create an Insurtech ecosystem that will ultimately lead to a design of an insurance product that will aim at improving the life expectancy of elderly people, but also providing them with a clear pathway that could improve definitely their quality of life. And that's what elderly people really need in this moment and deserve after this pandemic period. Thank you very much for your attention.